you?
Good, how are you?
Good. My name is Sam Texan. I'm a PA student. I'll be helping you out today. Can you confirm your name and date of birth?
April 17th, 94. My name is Sammy Sosa.
Okay, awesome. So it looks like we're going to be doing a couple of screenings today. Is that okay for us to do?
Mm-hmm.
Before we get started, can you just tell me a little bit about what brings you in today?
Yeah, I'm just having like really sharp back pain in my lower back.
Okay. When did they start?
It was like 2-3 days ago. I was trying to pick up a fridge, then I dropped my earring, and then went to go pick up the earring, and then just like got a really sharp pain in my back.
Would you say lower back or like in your back?
Yeah, like lower right.
Okay. Did you feel pop or crack or anything when you did that?
No, it was just like a real sharp pain.
Okay. And then when you have the back pain, how long does it last?
So it's kind of like all day,
Okay.
and then it's just been getting worse. Like honestly, I feel like my back is broken.
Okay. And then you'd say it's like that's constant throughout the day?
Yeah, like constant every day.
Okay. And then what does the pain feel like to you? Like, is it dull, achy?
It feels like knives are in my back.
Okay.
And then like when I walk, it's super achy.
Okay. And then can you just rate it from a scale from 1 to 10, 10 being the worst pain you've ever felt in your life?
It's definitely a 10.
Okay. Is there anything that makes it better or worse?
Well, honestly, I drink a lot of alcohol,
Mhm.
so I don't have to like think about it.
Okay.
But when I like walk or I sit for too long, then it hurts.
Okay. Okay, have you noticed any other symptoms that happen at the same time during this back pain? Or do you feel nauseous? Have you been vomiting? Having any diarrhea? Just like any other associated symptoms?
No, to be honest, it's just my back. But actually, now that I think about it, I do get really sweaty.
Okay.
And I gotta use the bathroom a lot. Like I have to use the bathroom right now, actually.
Okay.
And when my back pain is really bad, that's when I feel like I have to go to the bathroom.
Okay.
And then I do drink a lot, like I was saying. So I don't know if I'm going to the bathroom because I drink a lot or if it has something to do with my back pain. And then I'm not losing weight. Shoot, I wish I could lose weight. I eat too much.
Doesn't everybody? Let's see. Have you tried any treatments to help you with the back pain? Like any over-the-counter meds, anything like that?
I take aspirin, but honestly, aspirin is not working, and I feel like I need something else that's really gonna knock it out.
Okay. Are you allergic to anything?
I'm allergic to tramadol.
Mm-hmm.
I'm allergic to codeine.
Okay. What happens when you take those drugs?
I get like rashes.
Okay.
And I throw up too.
Okay. Let's see. Have you ever had any surgeries or any hospitalizations recently?
Well, see, I used to do street drugs, so I've been hospitalized for that.
Okay.
And then, yeah, I think that's pretty much it. But that was such a long time ago.
Okay. Are you taking any other meds? Like any prescription, over the counter?
I take ashwagandha because I'm like super stressed, and I was told that was supposed to help.
Okay. And then for the medication that you mentioned earlier, the tramadol and the codeine, did you go to your PCP for that? Or is this the first place like you're asking for payments?
No, so I went to them.
Okay.
And they gave me it, but then that's how I knew I was allergic to it because I took it and then started throwing up and stuff.
Okay. And then can you tell me about your family history?
To be honest, I don't know my family.
Okay.
But I do have a lot of kids.
Okay.
And then honestly, my mom was a crackhead.
Okay.
That's the only thing I know about them.
Okay. And then I noticed that you said that you drank some alcohol. How much alcohol do you say that you drink, like daily or?
Well, I drink every day.
Okay.
Maybe like 3 glasses of wine a day. I don't smoke. Well, yeah, I don't smoke. I've hit the vape once.
Okay.
But I don't really like do that anymore.
Okay. So you were saying like 2 to 3 glasses of wine a day. Okay. So I think I have all the information I need for my history part. Let's just go ahead and get into the screenings. So I will first screen you This test is called the SOAPPR. It's a revised screener and opioid assessment for patients with pain. It's just going to assess you to see just how you are going to be with the opioids. So it's just a whole bunch of questions. I'm just going to go through them. You just give me a 1 or 0, 1, 2, 3, or no. Actually, just tell me whether it's never, seldom, which means like kinda, and then sometimes, often, or very often when I ask you these questions. Okay. Alrighty. How often do you have mood swings?
Sometimes.
Sometimes. Okay. How often have you felt a need for higher doses of medication to treat your pain?
Seldom.
Okay. How often have you felt impatient with your doctor?
Sometimes.
How often have you felt that things are just too overwhelming and that you can't handle them?
Sometimes. Well, seldom.
Okay. How often is there tension in the home?
Sometimes.
Okay. How often have you counted pain pills to see how many are in the room? How many are remaining?
Sometimes.
Okay. And how often have you been concerned that people would judge you for taking pain medication?
Sometimes.
How often do you feel bored?
Sometimes.
Okay. How often have you taken more pain medication than you were supposed to?
I never do that.
Okay. How often have you worried about being left alone?
Never.
Okay. How often have you felt a craving for medication?
Never.
How often have you had others express concern over your use of medication?
Never.
How often have you had any of your close friends had a problem with alcohol or drugs?
Never.
How often have others told you that you've had a bad temper?
Never.
Okay. How often have you felt consumed by the need to get pain medications?
Sometimes.
How often have you run out of pain medications early?
That seldomly happens.
Okay. How often have others kept you from getting what you deserve?
That seldomly happens.
Okay. How often in your lifetime have you had legal problems or have been arrested?
That seldomly happens too.
Okay. How often have you attended an AA or NA meeting?
I go sometimes.
Okay. How often have you been in an argument that was so out of control that someone got hurt?
That's happened.
How often have you been sexually abused?
Never.
Okay. How often have others suggested that you have a drug or alcohol problem?
Seldom.
How often have you had to borrow pain medications from your family or friends?
Seldom.
Okay, and then how often have you been treated for an alcoholic or drug problem?
Never.
Okay. Alrighty, let me tally up. 1 second. Okay, so you scored a 27, and it means that you're at a severe risk for opioid abuse. Let's go ahead and get into the next one. This one's called the DAST, the Drug Abuse Screening Test. These are just 10 questions. I just need you to answer them with a yes or a no, okay? Okay, have you ever used drugs other than those required for medical reasonings?
Yes.
Okay. Do you use more than one drug at a time?
Yes.
Okay. And then, are you unable to stop using drugs when you want to?
Yeah, sometimes.
Okay. Have you ever had blackouts or flashbacks of a result of drug use?
No.
Okay. Do you ever feel bad or guilty about your drug use?
No.
Then, does your spouse or parents ever complain about your involvement with drugs?
No.
Okay. Have you neglected your family because of your use of drugs?
Yes.
Okay. Have you engaged in illegal activities in order to obtain drugs?
Yes.
Okay. Have you ever experienced withdrawal symptoms when you stopped taking drugs?
No.
Okay. And then have you had a medical problem as a result of your drug use, like memory loss, hepatitis, convulsions, bleeding?
No.
Okay. So you scored a 6, so that means that you're at a substantial level and need some assessment to that, but let's go ahead and just figure out what we want to do. Alrighty, just for the next couple days, I don't want you to do any heavy lifting. I kind of want you to just relax. You can use some ice or a heating pad for your back pain. Just don't do any extreme workouts or put your body through any extreme stress, just because right now you are having back pain that seems to be associated with exertion and things like that. Sometimes what helps me, and I know that some of the patients say that it helps them as well, is like if they're having lower back pain, that's sleeping with a pillow between their legs at night can help relieve some of that pain. And there is a couple videos out there that show you how to properly pick up things without using like your back, because you could have just hurt your back trying to lift the fridge. So yeah, there's a couple videos that can show you whether to lift with your legs or your back, so that can help you there. Also, I just want you to keep drinking water, having a good diet, exercise a little bit, but when your back does get better, so you can strengthen those muscles in the back. And then think about cutting down on your alcohol a bit. The vape, yeah, it was one time, but that's fine. But yeah, definitely cutting down on some alcohol would help you out. Also, I know that you said you don't have that much support from home. That's correct, right?
Mm-hmm.
Okay, so I have a couple of resources that can help you out. They're like coping groups and groups that you can go and just have people there that could that you can build relationships and friendships there. So that could help you out with even daily activities. So like obviously you shouldn't be lifting the fridge. So going to these groups can give you friends that can help you do all those things like that. Not saying that you need them, but I'm just saying that it can help some of the things that's going on. But I will go ahead and prescribe you a low dose of hydrocodone, 2.5 milligrams of it for 3 days only. I'm gonna go ahead and refer you to pain management. If you need more medication or if you need anything like that, I would definitely refer you to them because they can help manage your pain, just because after your physical exam, I don't see anything that's very, pertinent that's causing like a red flag for me to do anything else. But I don't want to say that your pain doesn't exist, and it does to you. So I hope that this medication will help, and that the pain management clinic will definitely help you out. Okay, sounds good?
Thank you.
Mm-hmm. Okay, now I'm going to present to my preceptor. Okay, I'll just turn this. Okay, I have Sammy Sosa. She is a female that is 29 years old, that's presenting with lower back pain. There was an unclear start date of the symptoms before, but she did note that it was worsening after 2-3 days ago after trying to lift a fridge because she had an earring underneath. She notes the pain as like a sharp pain with like knives are in her back. She notes that it's achy. When she walks or sits for a long period of time. She has tried codeine and tramadol in the past, but she states that she's allergic, and her allergic reactions is hives and nausea and vomiting. She definitely would like a stronger medication. That's what she specifically said in her exam. She notes that she drinks every day, 2 to 3 glasses of wine. Her past medical history doesn't really have anything so her past medical history, she had multiple hospitalizations due to related IV drug use. I'm thinking like maybe overdose or something like that, but she didn't really specify, so we can look through her records of the hospitalizations. Her physical exam, she was tachycardic, elevated blood pressure of 142/96. She had some limited mobility to her back. She had a limp on her left side while I was assessing her gait. Discomfort while palpating entire back, not just her lower back. No edema, no rashes. Temperature of the skin was normal. Her spinal cord was aligned. Everything looked pretty normal. And my treatment plan I would like to give for Sammy is I would like to prescribe her the lowest dose of hydrocodone, just because she said that she was allergic to the other medication. And I only gave it to her for 3 days. And then I immediately referred her to pain management to help her receive better care. I just feel like our physical exam, along with the history, that she would be better taken care of at a pain management, just because some of the things in her physical exam and her history didn't really line up together. Also, I did counsel her on a couple of things like just daily lifestyle and just family support and things like that. But yeah, thank you. I did forget to tell you that I performed a DAST screening exam on Sammy, and she scored a 6 out of 10, which means that she has a history of drug abuse, and she is a candidate for some intensive assessment according to the screening. Also, I did do a SOAP-R screening on her, and she did score a 27. It's really, really high, so that means that she is likely to abuse drugs if given. So with having that, I do think it's still appropriate to give her, the lowest dose of hydrocodone. I know she said that she was, going to follow up with the pain management referral. So I didn't want to give her too long of a dose, just in case that was, what was going to happen. 3 days, I don't think, 3 days with the lowest dose, I think it's appropriate for this patient.